So now we'll continue with a couple of more formulations first, maybe three or four, and then we'll go on to study the herbs today. Um, So the first product that we are going to talk about is Lashunadivati. So yesterday we spoke about a product called Shankhavati, which is more of a product which is used for digestive problems, ajirna, indigestion, bloating, etc. So Lashunadivati is on the similar lines. It is a similar product which is used for a same kind of an effect. The ingredients of Lashunadivati, if you see here, are garlic, shunthi, maricha, pippali. So trikatu, basically shunthi, maricha and pippali, they form the trikatu. Garlic is there. Hingu is there. Saindhav, which is rock salt, is there. Then there is gandhak, that is sulfur, and it is triturated with lemon juice. So the formulation is primarily, trikatu, garlic, then Saindhav, Hingu, that is asafoetida, and sulfur. And it is triturated with lemon juice. And it is called as Lashunadi Vati. It is also called as Gandhak Vati. Gandhak means sulfur. And because of the sulfur in it, it is also called as Gandhak Vati or sulfur Vati, so to say. All ingredients are Deepana and Pachana. All the ingredients in this are mainly Deepana and Pachana. It is used in Agni Mandya, it is used in Ajirna, in it, and its associated symptoms like bloating, abdominal pain, colic pain, nausea. So mainly Ajirna, that is indigestion, and Agni Mandya is where Lashunadivati is used. And it is basically used for Agni-mandya Ajirna and the symptoms associated with it, like heaviness in the stomach, bloating, abdominal pain, and nausea, excess salivation, and feeling like vomiting, etc. Garlic and hingu, that is garlic and asafoetida, they regulate the intestinal peristalsis and helps in digestion and absorption. Now, both these garlic and asafoetida, they regulate the intestinal peristalsis, which means the movement of the intestines are basically regulated by these two, which is important for digestion because, as we have studied previously, also that the food needs to stay in the digestive system in particular area for a particular period of time, so that the processing happens completely and the process is completed in a certain manner. Mostly the problems that we see with the digestive functioning is usually that the food doesn't stay enough for digestion, or it doesn't stay enough for the reabsorption to happen. And that is why either it's a problem related to the digestion not being complete, or it is a problem related to malabsorption. So these are the two things, and the basic cause for that is that the samana functioning, or the samana and the vyana functioning, they are impacted, and that is what does not let the food stay in the small intestine for larger duration, or as expected, for the digestion to be completed and the absorption to be completed. Now both these things can be improved by use of this product Lashunadivati, because it has got garlic and hingu, which have got a natural effect of regulating the intestinal peristalsis. So the intestinal peristalsis governs how much time the food will stay in a particular area, and then the food will be propelled further. So that is an important function which Lashunadivati will do. It is used in all types of colic pains. Colic pains are spasmodic pains where you get a sudden spasm of pain, which is usually seen in intestinal conditions. It is also seen in urinary conditions like the urinary calculi. There is spasmodic pain that happens, and also seen in menstrual conditions when during the starting of menstruation there is spasmodic pain where there is cramping of the stomach, cramping of a certain area, and then the pain happens. That is basically called as the colic pain. And for that, Lashunadivati is used, and hence you can say that Lashunadivati acts like an antispasmodic. Okay, so it reduces the spasm, it reduces the pain with spasm. Hence, it functions like an antispasmodic. So you can use it for intestinal colic where there is, say, an infection and then cramping is happening. You can use it for urinary calculi where there is, because of the urinary stone, the colic is happening. You can use it for gallstones where there is gallbladder stones of bile. So what happens is the bile, when secreted from the liver, it goes into the gallbladder and it is stored there. And from the gallbladder, it is released into the small intestine. So sometimes what happens, because of the pitta, when gets aggravated too much, this pitta dries up the bile. This pitta dries up the bile, and the gall and the bile that is there in the gallbladder, it forms stones. It becomes hard. It becomes like stones, and then that can cause problems like pain in the stomach. It can also then result into bile secretion being obstructed to flow into the intestine, which results into bile not reaching the small intestine, which results into digestion being impacted. It also results in stools becoming whitish in color because the bile is the thing that gives color to your stools, etc. So all these symptoms will be seen. But here, when there is gallbladder stones, if that gallbladder stone is impacted in the bile duct, then that can cause spasmodic pain. Even if the gallbladder stone is big enough and it causes irritation of the gallbladder wall, that will also give a spasmodic pain. So in both all these cases, Lashunadi Vati can be used as an antispasmodic to correct the spasmodic pain, cramping pain. And in menstruation also, women have this cramping pain in their lower abdomen, in the lower back, or in the thighs when during the menstruation or before the menstruation. There also Lashunadi Vati can be used. Now, this Lashunadi Vati is usually used with warm water. So you can take the tablet and drink warm water over it. But it is also said that for better results, it is good to chew or lick this tablet and rather than gulping it down with water. Same is the case with Shankhavati also. Shankhavati as a tablet, you want better results, it is better to chew the tablet and then drink warm water, or lick the tablet and let it get absorbed through your tongue and through your digestive system to have better results, faster results. Now the dosage is, for ajirana, for indigestion, you give one tablet about 4 times a day, 3 to 4 times a day. For spasmodic pain, when there is colic pain, spasmodic pain, you give one tablet every 15 minutes till the pain reduces. So you might have to give, say, 5 or 6 tablets over the period of 2 hours to reduce the pain. So that is the dosage for Lashunadi Vati. The next one is Khadiradi Vati. Now, Khadiradi we just saw in the treatment of CAS that this is used for Kaphaja type of CAS, or this can be used for various types of cough problems. Now, what are the ingredients of this? The ingredients are Khadira, Lavanga, Kankol, Jatifala, that is nutmeg, Jaipatri, that is the leaf of nutmeg, and Karpura, that is camphor. Okay. Now, all these ingredients are primarily Kanthya, that is good for the throat. They are used for respiratory system. They are used for the throat problems. All these ingredients. Lavanga is clove. Lavanga is clove. Jatifala is nutmeg. Jaipatri is the leaf of nutmeg. Karpur is camphor. Okay. Camphor, I'm not sure whether you are aware of it or not. Camphor has a natural tendency of increasing the oxygen availability in the body. So, inhaling camphor improves the absorption of oxygen into the body. And that is why when people go at high altitudes, people are going at high altitudes, they are advised to carry camphor with them. So that when you feel breathless, when you feel short of breath, you inhale the camphor, so that when you're inhaling, camphor has a natural affinity of bringing oxygen towards it. So when you inhale the camphor, you tend to inhale more oxygen, which then corrects the issue of breathlessness or being short of, feeling as if you're not having enough oxygen. So that is taken care of. So camphor has that natural affinity of pulling oxygen towards it, and that can be used for respiratory problems also. And that is why you will see camphor also is used in a lot of formulations which are related to respiratory problems, because one, it is vasodilator, it dilates the blood vessels, it dilates the respiratory passages, so the passages become wider, larger, so that the air passages become larger, making the airflow easy. So that is why camphor has been used in a lot of preparations related to respiratory system. So Khadiradi it is Kanthya, good for the throat. So it improves the voice. It will reduce it will reduce the symptoms of hoarseness of voice. It is also good for dry cough. It is also good for dry cough or in general cough. In this, when you use Khadiradivati, the kapha gets liquefied and gets removed. The obstruction of kapha is removed, helping the patient to breathe freely. So, because of that, because of the kapha getting liquefied, it basically removes the obstruction, which is not just the important factor in the etiology or the samprapti of CAS, but it is also an important factor or important step in the pathology of bronchial asthma also. In bronchial asthma also, the kapha obstruction in the channels in the respiratory passages plays a very important role in the bronchial asthma to happen. And that is why liquefying the kapha, removing the obstruction in the respiratory passages is an important step for both these diseases to happen, and Khadiradivati helps in doing that. Yes, Nicole?
So when it liquefies the kapha, is it then just starts to circulate normally and do its job in that area, or do you actually start coughing the bad kapha up if it's bad?
So what happens is, the first, like we said earlier last when we were discussing the condition of CAS also, we said that the kapha, when we say kapha gets liquefied, that means what has happened, the kapha has become hard, kapha has become dense, kapha has become thick. Okay, now this thickening of kapha or kapha becoming dense is a function of vata. Okay, and whenever kapha becomes thick, kapha becomes uh, dense, the tendency of kapha to stick increases. The
Yeah.
stickiness increases. Now, and that is what causes problems a lot of times. Okay. Now, when the kapha liquefies, what will happen in the respiratory passages? When the kapha liquefies, the natural tendency of the kapha or the mucus in the respiratory passages is to flow in the direction of gravity. So, in the lungs also, it will go and settle at the bottom in the alveoli, in the air passages. It will go and settle at the bottom without causing any blockages.
Mhm.
Okay. So one is that. Second is it will start functioning or doing its normal function of lubrication, which it is not doing when it is dense and thick. In fact, it is causing obstruction. So when it becomes liquefied, one, it will start settling down, it will start flowing normally, and secondly, it will start lubricating. Okay. And third, like you rightly said, when you cough, the expectoration becomes easy. If there is the quantity of kapha has increased because of kapha aggravation, it becomes thick, it will stick to the walls. Then it is not going to get expectorated. But when it liquefies, when you cough, it will get expectorated. So the excess mucus, excess phlegm will get removed out of the body also. So all these three things will happen when the kapha gets liquefied, which is what is expected. Third is when the kapha gets liquefied in the processes that we have seen, we whilst understanding the treatment, we understood one important aspect of treatment is the movement of the doshas from the shakha to the koshta and from the koshta to the shakha. That is from the digestive system to the extremities and from the extremities to the digestive system. Correct. Now, if the doshas have to move between these two, they should not be sticking anywhere. Correct. So, if tomorrow you have to do, say, the kapha has aggravated too much, and you are intending to do a emesis treatment to remove the kapha out of the body, what is the basic thing required? The kapha has to get liquefied, and so that the movement of the kapha starts, and the activities that you do for moving the kapha from the extremities into the koshtha, they are helped. But they will only be helped if the kapha is liquefied, it is not sticking to the walls. Correct. So when we do the snehana as a prerequisite to any panchakarma or prerequisite to vamana, that is emesis treatment, this snehana, what it does, it increases the kapha beyond its normal capacity. So we are in fact increasing the kapha. So we are doing something which is actually opposite to what is supposed to be done. Meaning we are wanting to remove excess kapha, but we are still increasing the kapha. Why we are doing that? Because we will follow that snehana by a svedana process, which is fermentation, which will pacify the vata, liquefy the kapha, and this then excess kapha along with the kapha which is there in the various sites, extremities, dhatus, it will bring that kapha also into the digestive system to be removed out easily without any problems. So this movement of kapha or the any dosha is important, for which the stickiness has to be removed, the ama has to be removed. If I have to use the word ama, which is what causes the stickiness to happen, vata also causes stickiness to happen. So this obstruction has to be removed. This connection with the dhatus has to be removed. Then only the doshas will move into the koshtha, right? So, to give you a simple example, which will further explain the concept of this Shakha and Koshtha movement, when we say Shakha, it is said extremities. But what is extremity? Extremity is the dhatus. Koshtha is the hollow passage, hollow channels. So, we have to bring the doshas from the extremities, that is from the dhatus, into the hollow passages, into the hollow cavities, so that it can be removed out of the body. Now, let's look at an example of cholesterol. Okay, what is happening? We have seen, or we have studied, we have understood that the cholesterol sticks to the walls. Correct, the cholesterol sticks to the walls. Now, what is that? It is an associated association with the dhatu, right? Sticking to the walls is an association with the dhatu. Now, if this has to be removed, then what do? We have to remove, we have to do certain treatments which will remove this connection with the dhatus and bring it back into the circulation. Correct. We have already studied, and in the lecture also, which I had asked you to listen to, I have clearly said that cholesterol on itself is not a problem. Cholesterol sticking to the walls is a problem. Why? Because when it sticks to the walls, it causes obstruction, it causes srotorodha, which is what is the problem. So this obstruction has to be removed. The doshas have to be brought into the koshtha, and this is exactly what is expected in a treatment of cholesterol also. So when we do the treatment, for cholesterol, when we do the treatment, what happens? This association with the wall of the cholesterol, this association with the dhatu is broken. The moment it is done, the cholesterol comes into the circulation. The moment it comes to the circulation with no ability to stick to the walls, then there is no problem, because then it is a natural quality kapha which is doing its function of lubrication, giving strength, etc. We already seen that cholesterol on itself is actually important for the body, because it is going to do the function of lubrication, it is going to give strength, it is going to form your sex hormones, it is going to nourish the brain. So these are the important functions that the cholesterol has. It only becomes problematic when it sticks to the walls. And why it sticks to the walls? Because we have said, again, we have studied, or if you have listened to the lecture, I mentioned that it is the problem with the walls that causes the cholesterol to stick to the walls. So it was the dhatu vikruti It was the sthana vaigunya in the dhatus which made these fats to stick to the walls. Why? Because it's a natural function of the cholesterol to repair those broken walls, damaged walls. And that is why it's stuck there. Now, if we do corrective measure, if we strengthen that wall, if we also do that, then the cholesterol is not required there. It will move out, it will move into the circulation. Once it moves back into the circulation, then there is no problem. It can keep on circulating, do its function, nourishing the brain, forming your sex hormones, giving lubrication, giving strength, etc. So the concept of movement of doshas from the shakha to the koshtha is a very interesting concept where we don't have to think of extremities as your hands and legs and to that extent. It is a movement of the doshas from the dhatu into the koshtha, from from the solid spaces where the doshas have penetrated into the hollow spaces where the doshas can be removed out, where the doshas can circulate. The concept is that when the doshas go and attack the dhatus, they have moved into the shakha. And the line of treatment, what is the line of treatment? The line of treatment is break this samprapti, break this dosha dushya combination. Which means what? If you have to break the dosha and dushya combination, if you have to break this combination of the doshas and the dhatus, it means that the doshas have to be removed from the dhatus and brought into somewhere. What is that somewhere? That somewhere is the hollow spaces. So the moment the doshas will come into the hollow spaces, they are circulating, they are doing their function, they are moving freely in the body. They are not stuck into some dhatu, which is what is expected. So when we look at the concepts, you have to do a little bit of reading in between the lines as well. I have tried to explain it as much as possible when we did our studies, but this is also something that you have to do in terms of reading in between the lines, that what happens actually when the dosha and dhatu combine. Where are the doshas going? Doshas are obviously going into dense spaces, which are the walls, because there are only two things in the body: hollow spaces and dhatus. So, hollow spaces are all the koshtha. Wherever there is Akash Mahabhut, that is what is the koshtha. Wherever there is no Akash Mahabhut, that is all the shakha. What is the basic function of Akash Mahabhut? To allow the flow of substances, which means all the hollow spaces in the tubes are the koshtha. And all the walls around the hollow spaces are basically the shakha. So movement of, I kind of deviated a little bit, but this is important to understand that, when we say kapha gets liquefied and gets removed, and it was a very good question because helps you understand a concept bit better, that what actually happens when it liquefies. Does it come out? Does it get expectorated? Yes, it will come into the koshtha, which makes it easier to be expectorated out. It will come into the koshtha, which will make it easier to be vomited out. Because a lot of times, look at the kids, when they have a lot of mucus, what happens? A lot of times kids vomit. Correct? Why they vomit? Because the kapha has aggravated so much that the body cannot hold it anymore. And that is the natural way of the body to throw it out, which is vomiting. Why? Because kapha is in the upper part of the body. So the natural tendency of the body is to vomit it out through the nearest possible opening, which is the mouth. When pitta aggravates, what happens? Naturally, when pitta aggravates, people have loose motions. Why? Because that's a natural tendency of the body to throw it out through the natural orifice or the nearest possible opening. So when doshas are aggravated, when the things are brought into the koshtha, the body will, it will become easier for the body to balance itself, because then the doshas which are aggravated are available there to be thrown out. When they are sticking, then the body cannot throw it out, because if the body tries to throw it out, it will damage the walls. Clear? So also used in bronchial asthma, and it is to be licked with the candy sugar, that is the rock sugar. You lick the khadiradi with that, which is a, which is a very good product to do. A similar kind of a product is also available, which is made from licorice. So you can also use licorice extract for a similar kind of a result. Okay, licorice extract can also be used for the same effect of liquefying kapha, for oleation of the channels, for pacifying the vata, and for reducing the dry cough also. But the only problem with licorice is, if you take too much of licorice extract tablets, those candies, it can also cause nausea and vomiting. So that is also something which is kind of a adverse effect of licorice. Licorice also tends to increase the blood pressure. So that is also like a side effect of licorice, which has to be kept in mind whilst using licorice. It is not dangerously problematic, but has to be kept in mind that licorice increases the blood pressure slightly. So the next product is Shwas Kuthar. Okay, I had said that we'll talk about this product because we were talking about the respiratory system. So I wanted to, deal with one more product which is important for the respiratory system. Shwas Kuthar. The word itself, Shwas means asthma. Kuthar means destroyer. Okay, Kuthar means destroyer. The ingredients are mercury, sulfur, aconite, maricha, shunthi, pippali, manashila, and tankad. Okay. Now I want you to research on manashila and tankad. Okay, manashila is basically an arsenic compound. So again, a very interesting product, that using arsenic in medicine. So it's an arsenic compound, and Tunkan is basically a borax compound. So Tunkan is not poisonous or anything, but I want you to research both these products. Um, Manashila is an arsenic product, and Tunkan is a borax product. And Shwaskuthar has got these ingredients: mercury, sulfur, aconite, maricha, shunthi, pimpli, that is trikatu, manashila, and tankar. And Shwaskuthar, as the name suggests, is one of the most potent products for dealing with bronchial asthma, asthma problems, breathlessness, or even other problems of respiratory systems where there is excess of kapha association with the respiratory system. It will not be used in conditions of vata because of certain things which we will talk about. So this medicine destroys stomach shwas or bronchial asthma, hence it is called as shwas kuthar. The main ingredients are maricha, or you can say the trikatu and manashila. Okay. Now these two are drying in nature. Okay, these are drying in nature. If you see here, maricha, manashila, and tankad, they are dry. So they basically dry and absorb the kapha, and hence they clear up the respiratory passages, giving relief. So they will absorb the kapha, they will remove the excess kapha out, and it will clear up the respiratory passages, giving relief to the patient. but it will only be used when there is only kapha dominant condition. If there is vata aggravation, you will not use this product, because if there is vata aggravation, the kapha is already dried and sticking to the walls. Then if you use this product, it will further dry the kapha and make it more sticky, which is not what is expected with this product in the condition. So you will never use it with vata condition. You will only use it in solo kapha dominant condition, where there is a lot of mucus, lot of phlegm, which is easily getting expectorated, which is not sticking to the walls. But the amount of mucus or amount of kapha is very high. There you will use this product. It's an excellent product for kapha dominant shwasa or kapha dominant respiratory problems. Okay. Um, it also is used as a product for stopping recurrence. So basically what happens is, people who have asthma, they get attacks during a particular season, or they will get attacks, repeated attacks during a particular season. So the duration between the two attacks, if you want to prolong the duration, the time gap between two attacks, then taking Shwas Kutar helps in that. Okay, so taking Shwas Kutar will help in reducing that, increasing the time between two attacks. It will also work as something that will stop the recurrence. So if you take it like a preventive before the season starts, where the asthma attacks happen, that will also help in stopping the recurrence of it. Dosage is 2 to 4 tablets 2 times a day, and it is given with honey and ginger juice. So that's the anupan. Now, when we deal with conditions like bronchial asthma, uh, one of the most potent things which I have seen works for bronchial asthma is MSS treatment. Okay, MSS treatment is extremely potent for asthma patients. People who have bronchial asthma and who suffer from bronchial asthma, who have been suffering from bronchial asthma for years and years together, if you give them vomiting or if you give them MSS in spring season, okay, where the kapha has aggravated, this really helps in completely, like, at least, I have seen people who have undertaken MSS not having any attack for the entire year or maybe even more than a year. And this is like one MSS treatment will do that. And though the MSS treatment is, I will say that it's very tiring, and it's not something which is an enjoyable experience, I would say, because it's tiring experience. It's a tiring experience. It's a long process, and people have to sit and do it. You need to have a very strong mental strength to do that. It is not painful or anything. There is no pain, there is no distress, nothing. But just the amount of time it takes, and that whole process of drinking those decoctions and those sugarcane juice, and the feeling nauseous all the time and vomiting out, and that process goes on for 3 4 hours. That is tiring more than anything else. But in spite of that, I have seen that people who have done it once, they have gone back and done it every year. They will go to the doctor and say that, the Ayurvedic consultant, and say, we want to undertake the MSS treatment, only because of the results that they have seen with one single MSS therapy. Because people who suffer from bronchial asthma, they have really horrible times, when they have an attack, and they have to use those pumps and they have to use those steroids, which are not really helpful. Because what happens is, when you use the pumps, those pumps, the pumps, uh, they are bronchodilators, so they dilate the bronchioles. But what happens, repeated use of these pumps causes the walls of these bronchioles to lose its elasticity. Okay, repeated use of these bronchodilators causes the walls of these bronchioles to lose its elasticity. And then what happens once you have started using it, the elasticity reduces, then these pumps they will stop having action, or you will have to keep on using more and more quantity of this medicine to get results. So it is never going to be a process where you will be able to cut down on this medicine once you start using it, because every pump that you take, it is causing some adverse effect on the bronchial wall of losing elasticity to a certain extent. And then eventually, a stage comes where, you just have to keep on using more and more quantity of these puffs and pumps to keep your bronchioles dilated, etc. So, but what happens with the Ayurvedic treatment is that you do the Ayurvedic treatment emesis and the person is completely cured, I would say, of the asthma attacks at least for a year or more. And when I say at least for a year is because I am saying that most people, they don't realize that now they have taken emesis, so they also have to follow certain pathya rules, they have to follow a certain diet, etc., etc. People go back to their normal lives, eating the foods that they should not be eating. They'll continue eating abhishandi foods, they will continue getting exposed to cold. So all the positive factors which are there, if they are getting exposed to, still they will not have any bronchial asthma attacks. But obviously, people who follow a certain regimen, follow the pathya, they will have a longer effect of a emesis treatment. And my personal opinion is people, who are interested in studying Ayurveda or who are interested in actually using Ayurveda, they should once experience emesis treatment on themselves or at least see the results of these treatment. Whether you are able to do it, not do it, that's secondary. You know, uh, I mean, at least in Australia, it's going to be difficult to do it. But if suppose there are students who are from other countries and who can go and use it in other places, then they should at least experience this treatment uh, coming to India, or they should experience it how it is done on patients, because it's a wonderful treatment to be done. I mean, I have personally experienced this on so many patients. Bronchial asthma is just one of the type of patients I have used it on. Skin diseases, psoriasis, chronic skin diseases, hyperthyroidism, weight, overweight, obesity. All these cases, we have used this on multiple patients, and the results have been absolutely amazing with MSS treatment. So that is one treatment which I feel, you know, whoever is very keen on studying Ayurveda should come and experience personally, or at least see it how it is done, and see the results of that treatment on people who have undertaken this treatment. Because um, that is something which clearly tells you as to how uh, effective a particular treatment can be, in terms of the concept of Ayurveda being followed correctly, and then how it works. So, because this is a treatment which removes excess kapha and pitta out of the body, and bronchial asthma or Shwas being a condition of kapha does wonders on in terms of MSS treatment. So anyway, so this is Shwas Kuthar, which is again a product which is very commonly used and should be used. You will research on Manashila and Tankard, and whenever we meet next time, which is probably going to be January, we will be talking more about it and studying more about certain products, etc. Okay, I think I've finished with this short presentation I had.